Welcome everybody to the Personalised Health Summit 2015. Super excited to be welcoming our guest Penny Caldicott today, who's going to be having an amazing conversation with us about integrative medicine and how this applies to the masses. First, just wanted to set the intention for this call and for this entire summit series, that we're really looking to bring a lot of information and a whole wealth of knowledge and wisdom from 30 experts from all over the globe in various areas such as nutrition and exercise and sleep, meditation, consciousness, mindfulness, medicine, science, world health solutions. And all of this information is here so that you can find out more about yourself, more about who you are and what's right for you to be happy and healthy. So a big thank you to our major sponsors, Ultimate Human Foundation, who's working towards the elimination of chronic pain and disease from the planet. And a big thank you to PH360, who's looking at application of the tangible information from personalized health and epigenetic insights to better help you understand what's right for you to eat, how to move, how to play, how to think, how to love, how to act. So please check out those websites, ph360.me. We'll get you to check that out as well. But a huge, huge thank you to you for being here, for investing the time in your own health, in your own life, towards understanding a lot more of these insights that are available right now and how you can utilize those to transition to a space of health that you're looking for. So without further ado, I'd love to welcome Dr. Penny Caldicott today. Penny is a Director of Invitation to Health and the current President of the Australasian Integrative Medicine Association, AIMA. By the age of 17, the calling to be a doctor was strong. While studying at university and interning with the hospital, Penny was dreaming about the evolution of medicine towards an integrative model that would embrace the medicine of the heart. While working in a traditional general practice, it became clear that integrative doctor working in isolation was a start, but working with a team with other skilled therapists would be ideal for professional learning, emotional and spiritual evolution, and patient outcomes. Penny, we're so excited to have you here today. Thank you so much for joining us, and love to welcome you to this amazing summit that we've got going on right now.
Thank you, Matt. It's a real privilege to be here.
Beautiful. Well, Penny, I'd love to jump straight in and just hear a little bit about you and your story. I know that the work that you're doing throughout the globe is amazing. President of AIMA is such a big deal, and we really love and support the work that you're doing and really encourage everybody to get behind everything that you're up to right now. Please share a little bit about Penny and how you got to be doing what you're doing today, and what your sort of mission or intention is, and how you're looking to go about that.
Okay. So, look, that's a lovely summary that you gave to start with. It's true that from quite a young age, I felt like I had quite a calling really deep in my heart to be involved in medicine. I had two parents who were doctors and very traditional doctors, so I really fought that desire to go and do medicine. But eventually it became too strong, and I got into a course in near Sydney, north of Sydney. And in this course, part of the interviewing and acceptance process was a kind of neuropsych assessment and an interview. And I think that's how I got in, because it was really so much in my heart and such a strong desire to do medicine. But I never really wanted just to do the conventional medicine that we see today. I felt like there must be another way, but doing a medicine course was the way to get started for me. But as I journeyed through the medical school, I realised that none of what I was seeing was really reflecting any kind of healing processes, and I could see that was the big limitation. I mean, look, conventional medicine, or the medicine we use today, is wonderful. It's incredible for acute things. But we're not so good at managing chronic things, and we're not so good at stopping people from getting sick. So I did start a journey that basically, my patient, I was in conventional general practice, but my patients would come and see me because I believed that they had chronic fatigue, for example. So nobody else in my area really believed that at the time. And then once I had a whole lot of chronic fatigue patients, I thought, God, I better learn what to do with these people or how to help them, apart from just believing them and being present for them. And so I started attending a lot of conferences on this different kind of medicine that really looks more at the functionality of the body and of the whole person, to find a way to get some answers. And then I did what many of us do that's very transformative, and that is I had kids. And I thought that was going to be like the easiest, most wonderful thing to do. And it has been the most wonderful thing to do, but really initially incredibly challenging for me. I had a baby who was my first baby, who was very challenging, and who eventually was diagnosed as having Tourette syndrome, which we didn't know until he was, 11 or 12 or something. And so so I went looking further in my medicine to understand more about my son and what would help him and with his anxiety and help him to just be more comfortable in his skin. And I found more kind of tools that were, that really changed my way of treating my patients. And so that was really fantastic. I also have been on kind of quite a really wonderful transformative spiritual journey in my time, which has really helped me to understand myself better and help use that inner guidance that we all have to direct me towards the things that I most need to be doing, so to understand my mission and my passion better. In about 15, 16 years ago, I was walking in the bush and I just had this kind of just download for a vision of a medical centre, and it was pretty surprising because I just never thought I would want to do anything like that. Bit exciting, bit scary, let it go for a couple of years, and then realised, talking to a friend from France, that a group of people I knew were doing something pretty much what I'd had a vision for, and realised that I was just being asked to be a caretaker of this vision. And this vision was to create an integrative medical centre that really looked after the whole patient, one where we could work in teams of integrative practitioners, and really look for the best ways to help our patients on their journey towards wellness, and also be really integrated as part of our community.
Beautiful, Penny. Thank you so much for sharing that. And it's a really great introduction to integrative medicine and how you've been on your journey, starting out in traditional medicine and actually realizing and experiencing that there's more to us. There's more to the human being, there's more to the human body than just what we can actually see and tangibly measure even at this point in time. And I guess I'd love to for you to be able to share with the audience, for those listening in live or watching the replay, about what is integrative medicine, and we talk sometimes about different parts of the being. We talk about not just the physical but emotional energies and physical, mental, our spiritual experience. But there's also the integrative medicine that may refer to a lot of differences in the way that we look at things, the way our perception is about medicine, and an integrative approach with working with other different holistic practitioners in many different fields. Could you be able to describe to us what is integrative medicine and how can we start to harness these concepts to move to a better state of health for us?
Okay, so in the US, integrative medicine, integrative is a difficult term really because we're using it for so many things now. But basically, in the US, they often call it functional medicine, and functional medicine's looking at function and where things are not working in the body and how to help them work better. It's actually, on the whole, I would say kind of a conservative approach, and by conservative, we're not talking about left, right. We're talking really about conserving function using the most least harmful of processes and substances to help the body back to a state of well-being. But it's basically about using the best that we can find of evidence-based approaches to address either dysfunctions or diseases with a whole person approach. And we're not so concerned about the diagnosis. What we want to understand is, how did people get here and how do we help them on the journey back? And as you said, Matt, absolutely, it's the whole person is the mental, emotional, spiritual and physical, and as an integrated practitioner we're always watching to try and address the whole person as we're able to and as people are ready for it.
Beautiful. Thanks, Penny. I know that we've shared lots of dialogue over the years, and really the new understanding about medicine, where it's moving from more asking the question what, instead of what symptoms do you have, and if you have these collection of symptoms, then this is what your diagnosis is and what drugs you take, or this is what management you should do. It's really moving more towards the why medicine and looking to say, well, why are these things showing up in the first place? What's underlying? What's the root cause of these issues that may be showing up as these sort of symptoms in the body? And it really is a really powerful time to be moving towards that. And I really love the work that you're doing, spearheading the whole of Australasia in this way. And it's just we're very, very grateful for the work that you're doing, and thank you so much for sharing what you're doing with the world. So Penny, I'd love just to transition towards a conversation about how we can start to apply some of these principles to the masses. And maybe we can start from a point where we, talking about the logistics of how that could even be possible, but then also relating that back to people who are listening in live today. They may be sitting here watching this, suffering from pain or disease right now. Maybe they're in a state of health and they're looking to prevent disease from coming. What's sort of the ways that we can approach this from a large scale, and then how can this be something that's a way that we can tangibly approach this from ourselves, just individually sitting at home right now?
Okay, so the principles of that keep us healthy and whole and well are actually pretty simple. And actually, every time there's some research done, we know that we come back to the same things. And all of the things that we can do for ourselves and in connection to others are much more powerful than any kind of medical or classical medical intervention that you can have. And so I'd say, first of all, our body is our temple. So our body is infused or inhabited with our soul, with our spirit, with our heart, with whatever you want to call that. And at the same time, amazingly, we're connected to everything, right? So we know that through many different ways of looking at it, through science, through our kind of electromagnetic vibration, through quantum physics. And so in the past, I guess there were lots of things that helped us stay well. So for example, we ate clean food. Imagine that, like people go that don't understand what the whole organic food thing is. But like 50 years ago, we didn't eat anything but organic food. So we're just in a big experiment at the moment. Right. So we ate clean food. We weren't surrounded by the 140,000 plus chemicals that we're now surrounded by. We had, we led common lives with others within a community where we were connected. We probably had rituals that helped us to understand about being connected back into ourselves and to everything else, and which in different ways was different expressions of spirituality. And we also weren't kind of addicted to this stress of doing all the time. So now it's really about, you got to be doing, or you're not worth very much, and we just forget that time out to just to be with each other, to take a break is much more valuable for us than doing, and recharges us so that we can go and do what it is that we're here to do. And so go ahead.
No, I was just going to say beautiful words, Penny, and I'd love to hear a little bit about maybe what's happening at a larger level. I know that you're obviously working with big organisations. What can people be expecting, or how can people be supporting some of the work that's happening in the bigger scale to be able to bring this information in? And I just wanted to maybe preface that with the fact that for those listening live here or watching the replay, often we don't, we're not aware of the enormity of conversations like this. But for a medical doctor to be recognising that there's more than just medicine is a big feat, because it's not taught a lot at a medical school, that there's a lot more involved in human health, that the foods we impact our health in a big way, the exercise or the time of exercise we go about influence our health, the climate we interact with, or the people we hang out with, the way our mind works, our natural flow and talents, all these things, they're not common topics at medical school. And so the fact we're talking here with Penny today, who gets that, who also understands that there's emotional components and mental components and a spiritual experience that we're all here for, in itself is quite profound. And the fact that Penny's out here leading Australasian Medical Association is extremely powerful. So I just wanted to sort of set that scene, Penny, because I really appreciate the conversation you're having with us today and the enormity of what you're involved in, bringing this insight and this depth and this perspective to the bigger community and the bigger conversations. So sorry, please let us know a bit more about what's maybe happening at the bigger levels from this, and what we can do to contribute even towards what's going on there.
So I have to say that this kind of wave of a new medicine is driven by the desire of the people, basically the community. I don't think it's, there are doctors who are passionate about it, but I really think the drive's coming from the patients and the community that's demanding something different. So people are really sick of going to their doctor and getting stuck on a medication and then another one, and basically, feeling unwell and then progressively having their autonomy taken away. And then, you're just a kind of passive recipient and you're stuck in a state of chronic illness, which so many people are. And so the public are really driving this. And what my mission is, what I feel my mission is at the moment really is to, individually with my patients, I do my integrative medicine work, and we can talk about that if you like, but really is to help get the message out there about a new way of medicine that takes in the whole person, of helping doctors who are, we're actually calling them I'm curious, so I am curious doctors. So there's doctors who are already I am doctors or functional medicine doctors, and the I am curious are quite a large group. So in Australia, in one survey, there were about 75% of GPs who went, I'd really like to know more about that. You know, magnesium sounds good, but I don't know how to use it and when to use it and what dose and what type and at what timing and that kind of stuff. So they're starting to really be interested. But we also need to inform the system a little bit more about what's available, because at the moment we've got a medicine that's very expensive, very interventional, causes lots of side effect, is quite toxic. And it's not because you metabolize the medications that they're gone. They're in the systems, man. They're in the waterway. They're on your veggies. They're in everything, you know. So we have to come back to a much more conservative approach where we start to help people to get back to an intuitive way of staying healthy. So like what you talked about, so the exercise, the connection to others, the deep connection to yourself, the good food, and all the kind of nourishing things that you can do in your life and following your passion and all of that. And it sounds really simple, but our system is so heavy and so driven by, by companies and forces that have a huge amount of power and money. And that's what's driving our medicine. So we have to re-inform the system that there's another way to do it that's actually cheaper, safer, more conservative. And as you said, really personalises the approach to each person. I know you guys are going to hear from Bruce Lipton, my lovely friend Bruce Lipton, who talks a lot about the epigenetics that you also talk about, Matt. But, you know, clearly, we all carry a different set of genes, but our genes are just like architectural plans. They can't do anything, you know. They need a builder and they need a plumber and they need, you know. So what we have on each of our genes is we've got these regulatory proteins, and the regulatory proteins are informed by your environment to activate parts of those genes, and then those genes are able to express. You also have this great system in your body that each gene has a little tail, and if this little methyl group sits on a tail, then those genes will never activate. So we understand more and more how to help, how to kind of guide that information so that our genes express in the best way possible. And it's just and actually so much of it is real common sense, and that's what we need to go back to. So we need to inform the medical associations. We need to lobby the government and tell them how this is a much cheaper and better option for them. We need to get into the medical insurance companies, because they're really pragmatic, man. They don't want you in hospital for days. They don't want you having stents once you've got cardiovascular disease. They don't want to support your diabetes forever. They don't want you to get dementia, which is happening at younger and younger ages now because of all the inflammation in our brain, and get the insurance companies to help support, and many of them are starting to do this, programs that bring us back to a much more kind of intuitive and sensitive way of managing health and wellness. And I guess the conversation's starting to turn towards actual well-being. So we're only trained at the moment in managing chronic illness, which is a craziness, right? Why would we want to manage someone who's chronically ill? What we'd like to do is help them take a journey back towards wellness. And for every person, like you say, that journey will be a bit different.
Yeah, beautiful, Penny, and lovely words that are flowing there, and really opens up, I guess, a couple of points that you said there, particularly about the epigenetics, and you know, from that the understanding now, we know that our environment and our lifestyle influence ourselves in a very big way. You know, up to sort of 80, 90, even 90% plus influence us and who we are at this point in time with our state of health. Far more than our genes. Our genes are there, and our environment and lifestyle determine which ones are switched on and off at any particular point in time. Mm-hmm. Which is a really powerful insight and understanding that we're still pushing forward a lot in that capacity, and it really opens up a conversation as well, from an integrative medicine point of view, where we talk almost hand in hand about lifestyle medicine and the fact that the choices that we can make ourselves. People listening in at home right now or watching this replay, they have a choice. We can choose a lot of the things in our environment and lifestyle. We can choose the foods we put in our mouth. We can choose the exercises that we do or don't do. We can choose who we hang out with. We can choose what we think and how we think. We can choose a lot of these things these days, and we don't really understand yet the power of all of everything that we have to control a lot of our own health and our own future. Could you just share a little bit maybe about, from an integrative medicine point of view, maybe even how you work in a clinic, Penny, and what's the difference, just a very tangible way. If I was to come and see you versus to see my normal doctor, how would that be different, or how would you look at things differently? How does integrative medicine look at things a little bit differently than maybe a standard standard way of traditional medicine, if you like?
Okay. So we have quite a process when someone comes in where they fill in a very big questionnaire about all kinds of things. So we're trying to get a really kind of full picture of this person who's coming in. Our integrative nurse also then kind of interviews them and takes some measurements. And so by the time they come and see us, they're ready and we also look at things like, what is it that you want? What are you looking for? What are your goals? Where would you like to be? And what is the level of motivation you have for change? Because that's really important. And we need to respect that some people aren't quite there, and some people are rearing and ready to go. And so then what I would usually do is talk to people about, of course, why they're presenting. First, I take a really quite detailed history of their past, and most doctors would, I think on a first visit take a reasonably detailed history. But I'm really interested in all the influences that have got this person to this place that they are now. And it's interesting, some people might actually just come in for a pap smear, and they think that everything's just fine. And so then I would just do a little bit of a systems history about what's happening in their relationships, in their life, what their diet's like, what their chemical exposure's like, what their physical symptoms are. And so many people are so used to the way they feel that it's normal. And it may not be normal at all, but because that's the way they've felt for a long time, that's normal. So we help to kind of tease out where the issues are, so that we can take a kind of preemptive approach. So some people might not be kind of having real bad dysfunction yet, or they might not have a disease yet, but they've got things that just aren't working well. So the best thing that we can do is help them find their way to a state of real well-being. And so we look at all these different elements in their life, and for sure their level of kind of motivation, of awareness, of their capacity to actually connect, and because every kind of state is a kind of multifactorial thing, we might just choose to look at, they talk about low-hanging fruit. So I guess in a way it's like the things that people are most willing to look at or most willing to do that fit into their lifestyle, that fit into their family, that fit into everything else that's going on for them. And so part of our assessment would be a long history. I kind of go into the zone with people. I love hearing people's stories. So I do lots and lots of listening, and actually deep listening when you're in a state of non-judgment, and when you're really in a state where you can love the other person, because as doctors we can love the unlovable, because essentially they're not part of our everyday life. We're just in this kind of zone with them. And in that state, people often find things that they didn't even know about. And so that's a really rich and privileged place to be in, but that also informs the kind of ongoing journey and trajectory. Then we might do some testing depending on what's going on for them. Often I'm looking for nutritional deficiencies, because everybody has nutritional deficiencies now for a number of reasons. And then we'd look at where that person wants to go and how we can help journey with the person towards their goals.
Beautiful, Penny. And I love how you share that it's about the person. It's not about coming in and here's just the figure you get. The fact that you actually sit down and spend the time to listen and deeply and actively listen, to hear about people's journeys, to take in so much information that really contributes towards why they're in the state of health that they are in at this point in time. But the fact that it's up to us, it's always our choice as to where we go and how we feel and what we believe, and all these other great things that we're just finding out about now that really influences our state of health. It's not just about taking this blood test and getting this result and taking this medication. So
and we do. I talk a lot about that as well. That whole the stuff that Bruce Lipton talks about, your subconscious, how your subconscious really gets set up pretty much a fair bit by the age of 7, and so you've just been a sponge, and everything that comes in becomes part of your setting up your neural pathways, and then those neural pathways, unless you look at them later in your life, drive you. So he says that 5% of the time you're in this kind of conscious space where it's really your passion, your desire, your how you really want to see the world. But most of the time our subconscious is just kind of driving us to do things. So, sometimes we might have thoughts that don't really correspond with what we really feel inside, but that's just our subconscious mind kind of running its programs. But the really cool thing is that whole thing is just software and not hardware. And so I talk a lot to my patients about that. So you might be driven to do certain things, but this isn't your personality. This is just your software functioning in your brain. And these neural pathways can all be reset and reconfigured. And so I use that a lot with my patients to help them to find, a different way of thinking, a different way of doing things.
Beautiful, Penny. Thank you for sharing that. And if you haven't checked out the conversation we had earlier this week, actually, with Angie Johnsey, she went to amazing depth about the mind, about subconscious mind, about emotions, about everything. So please go ahead and check that out. And Bruce, who's coming out later next week for the conversations about that in a lot more depth too. So Penny, I just want to sort of highlight a point that you said where disease, like you paraphrase what you said, disease is not normal. It's common, but it's not normal. And that's a really important point to understand, is that often we're in a state of health, we may just assume that, everybody has pain, or everybody has these issues, or everybody has that, it's just a normal thing. It's actually not normal for our human body to be experiencing that. And so it's great to know that there's so many different things that we can do at this point in time. Just a little segue, we are interacting live with Penny today. So if you're listening in, please feel free to raise your hand if you want to join the conversation, to request to speak, or please pop your questions in the chat box as we're going. I can see a whole heap of questions come in already that we'll get to, and we'll interact with Penny throughout this interview. But Penny, I'd just like to bring it back, and this is a personal health summit. So we're talking about how everybody sitting here right now can actually start to harness some of these concepts. Could you just share with us a little bit about how you see, medicine, into the integrative medicine side of things, the connection between our lifestyle choices, and even things like consciousness and healing? How does all this sort of mix in together? Where does this all sit, and how can we start to sort of comprehend some of these concepts we're talking about today?
Yeah, look, I mean, I think that my understanding is that we've talked a bit about how our body is our temple, and our soul or our spirit inhabits our body. And my belief, or my understanding through what I've witnessed and experienced myself in my life, is that we all have talents, and we all have skills, and we all have insights, and we all have a kind of sense of mission or passion inside. But to a larger or smaller degree, we can be quite disconnected from that. And so I think the journey towards health has a huge amount to do with consciousness. And by conscious, I mean, I guess we have to explain maybe what that means. For me, our soul or our heart or our spirit is within us, and we have this extraordinary brain. And this extraordinary brain can do amazing things, but it does the most amazing things when it's informed by that deeper sense of ourselves, so our soul or our spirit or our heart. And then we can do incredible things. But when we're in a state where we're a bit disconnected for that, for so many reasons that we can talk about, then our mind can do all kinds of things and rationalize us into places that really don't suit us at all. And so some of the things that may have made us disconnected may be really kind of quite awful things, like really bad traumas, or some kind of abuse, or loss of a loved one. Or it could just be that we've got this little journey, but the people in our lives have never really treated us as an individual, or respected or understood who we were. And so we go into this kind of protected state, and the protected state is great when you're little and when you need the protection. But when we get older and more mature, what we're really needing is to take away all those protective mechanisms, so that our mind can really be informed for and work for this kind of inner wisdom and inner knowledge, and inner mission that we carry. And so I think that the spiritual or consciousness journey is really, really vital to our health, and it brings back a sense of kind of intuition into choices that we make.
Excellent. Thank you, Penny, for sharing that perspective, and just understanding that it's certainly more to us than literally the tangible skin and bones that we can touch. And that's we're learning more and more, and this summit's been great just to help people become more aware of the things that are actually out there that we can be aware of, and things we can observe about ourselves even the way that we think and the way that we perceive events, our beliefs that exist, that can determine and influence our emotions. It can influence the way our mind works and influence our spiritual journey. Is really great understanding. We've covered some concepts about personalization in many different aspects. Even we had a conversation earlier this week about personalized spirituality and about understanding that even meditation itself is very different for everybody. Some people will go crazy trying to sit in a room and be quiet and meditate. Maybe they're best suited to being outdoors doing some exercise, or maybe walking in nature, maybe doing something that really helps them relax. And we're talking about the reason, asking a better question as to why do we meditate in the first place is a better question than what sort of meditation should I do, or how often I should do meditation. And when we answer those questions, we're looking at really understanding about the fact that we meditate to completely relax and rejuvenate our physical body and connect with something that's greater than us. And so there's many different ways that people do that and engage with that. And there's no right or wrong. It's a very individual journey. And I really thank you for your perspective and all the amazing insight you're sharing with us today, Penny. We're going to jump to a couple of questions actually right now. I've got a lot of comments and a lot of questions coming through. Michelle says, I myself have had a long stay with chronic fatigue. I'm excited to hear what Penny shares as the causes, the cure, etc. I'm ready to leave this behind me. So Michelle, there's lots of hope for you yet. Cassandra says, I didn't realize integrative and functional medicine were one and the same in a sense. Thank you, Penny. Anthony asks, Penny, what is the whole person? Is this something I can feel day to day? And what can I do to address my symptoms from that perspective? It's a good question, Anthony.
Yeah, it is a good question. And I guess that's kind of what we were just leading into talking about just now. Yeah, I think we're kind of through the way we're brought up and through our culture, we kind of narrow our perception of ourselves so much that we become the physical body, and sometimes it's so narrow that some people are so much in their head that they can't even feel their physical body. So their body's doing stuff and it's sending them messages and stuff, but we're not even hearing it or not even feeling it. So we can become locked into kind of just here and then just ignore the rest of the body. And so there's all kinds of different levels of kind of understanding what the whole person is. Look, there's some of you might have read a book called Proof of Heaven by Dr. Eben Alexander, and he had this amazing experience. I'll try and be really brief about it, where he had what they call a near-death experience. So basically, he went into a coma, and his was a E. coli meningitis, and his specialty is he's a neurosurgeon. And so what he explains later is that this type of meningitis cuts off your whole capacity to think. So there is no other explanation for this man's experience. So he went into a 7-day coma, and there was almost zero chance that he would ever come out of this. And if he did, he'd have no brain left. But he actually woke up and he was conscious and he spoke and he had a little bit of rehabilitation. Now he's back to normal. But his journey was really amazing. And the kind of realms that he journeyed into gave him an insight into actually what we are as human beings. That's so much more than we think we are. The fact that we are actually connected to everything. And not only that, we're totally loved at all times, and it's surely not how most of us feel most of the time. And so so that's the kind of other end of that perspective. So you've got the just being in the head, and then the other end, which is really like a sense of actually being connected to everything and being loved at all times. And I think we all take these journeys, personal journeys, like Matt said, in really different ways. And there are different things that bring us back to a sense of ourselves. So it could be exercise for some, it could be extreme sport for others, it could be meditation, it could be prayer, it could be part of something that a religion's facilitating. It might have nothing to do with a religion. It could be that we just around people who unconditionally love us and bring us back to a sense of who we are. And I think that we can't feel the sense of being a whole person without really connecting deeply, not only to who we are, but also, like Matt says, to everything. And there's lots of research that's been done on some of these principles. But one of the simple things is that when when, you know, if you walk into a room and we say, you know, there's, you know, it can feel these kind of bad vibes. The fact is we do. You walk into a room, nobody's told you what's happening. You feel like something bad's gone down and it makes you feel anxious and distressed. And so we all have a capacity to feel that. But what we now know are things like the electromagnetic force goes out from our heart 1.5 meters. So if you're standing next to someone, you're totally in that person's heart space. And how that person's heart is functioning in terms of its what we call a heart rate variability actually affects the brain chemicals that you make and affects how you feel. So, I mean, the connection that we have even on that kind of close level is huge, but it can be on clearly much bigger levels than that. And the way we think and the way we experience things the way we think has a huge impact on how we're going to experience things, which is something that you also touched on, Matt.
Wow, thank you, Penny, for sharing that. And Anthony, a great question. Thank you for bringing that to our attention. And that we've had some great conversations already this week. It's been an amazing week. It's only the first week of this summit, and we just talked yesterday with Roland McCready from HeartMath, and we went into a conversation of how connected we were. And we are, and a lot of the research that they're doing to show that. And you know, for those that haven't seen that call, please go and check that out. It's fascinating information where they're actually looking at studies in different countries, people all over the world, and looking at the actual you know, magnetic field and magnetic information that exists in the Earth's atmosphere, and how they're finding actually that people in different countries, if there's an event that happens or the information that's happening is actually reflected in people in different countries all over the world in that exact heart rate. It's a really early stages of their research, and they're really excited about what's coming. And please check that out. That was a fantastic talk with Roland yesterday. And I really love how you're very aware of all these principles, Penny. And again, just the enormity of who you are and the position that you're in to be able to influence so many different people's lives and understand the concepts that you do and the perspective that you share is just so exciting. I'm really excited for everyone in Australasia, and really hope that you're able to share this message with a lot more of the world with what you're doing. We're just going to jump to a couple more questions here, Penny. We've got Rebecca says, only 15 years ago we didn't know what organic was because it was all organic. It's a little bit sad, but I suppose that gives us hope we can all do it again. Cassandra says, Penny, what you're saying now about us being connected with each other really resonates with me. I feel like I often forget that in my day-to-day efforts to become healthy. Any advice on how I can balance this, focus on my own health while at the same time focusing on the connection with others?
I think that sorry, I've got to go now.
That's okay. You can keep continuing, Penny. We can hear you well. It'll sort itself out.
Okay. I think that the way we are with others immediately has a positive impact or negative impact on ourselves. And the way we interpret what other people are doing has a big impact on us. So I just went with my little niece, was really keen to do this climate change march in Boston, and so we went into Boston together, and there were people who were going, yeah, you know, that's fantastic, and other people who were really aggressive and actually abusive and stuff. And we always have a choice on how we respond to that. So immediately the guy who stuck his finger out the window at us, you know, made me feel, you know, a bit tense and kind of uptight inside, and it has an immediate not only kind of emotional, but then biochemical reaction in me, and then I have to wear that until it settles down. But if we have the possibility of stepping back when those things happen and going, gee, is this particular thing have any relevance for me in terms of who I am and how I'm behaving, or is this thing totally about the other person? Then we already give our body a break from reacting to what's happened with the other person. And in a similar way, when we're very kind to someone, you know, when you just go out of your way to do that little extra something for someone, the amount of kind of joy and thankfulness that people have is just incredible. You know, like you stand in line and there's someone behind you and you just go, oh, I'm just going to buy their coffee for them. Like they just can't believe it. They can't believe that you would do something and it's this small, you know. And so that's just enormous. And probably the most profound experience I had in my life around this was when I was in my early 20s and I went to India and I was working in Caldicott in Calcutta in Mother Teresa's place, home of destitute and dying. And there was a woman there who'd been living on the street. And, you know, in India, if you're an untouchable, that's it. You just die on the street. She had a cancer and it was all just growing out through her belly and she was in terrible pain and they don't give pain relief there, but I managed to find some and give her an injection. And the next day I came back, and she used all her strengths to give me a massage. So, I mean, in essence, like, I gave her this and she gave me everything. And so I think that whole notion of being, of seeing other people, of connecting to them, of smiling to them, of doing something a little bit out of the ordinary to make them feel loved or appreciated or welcomed or seen, has this profound effect back on us all the time.
Wow, that's really powerful, Penny. Thank you for sharing that. And I've got a question here from Philip, who says, Penny, thank you so much for your amazing work. I'd like to ask, what have you seen in your practice as the most important or most effective way to regain health?
Look, I think from a more generic perspective, the integrative medicine doctor or practitioner is waiting for you to come in with something as an in, you know. So it's something that's enough for you to come in, you really want to do something about it, and we don't care really what that something is. It's an in into finding out what's happening for you so that we can help the journey. And so I think that for me, the most important tool that I have is to be really present and to listen. And if I'm really present and I really listen, and sometimes it happens when, like, you know, someone comes in with this list that's this long and I'm like, oh my God, how are we going to get through this? And I start to feel bamboozled and not sure where to start. And I just go, I just have to hand it over and not try and work this out. That the best connection comes between me and that patient. And somehow we find ourselves in a space that is not, that I couldn't have predicted, you know. We find, like, especially in teenage boys who are kind of really closed up, or girls who are really stressed, and you find yourself in this like little soft spot, you know, where you've just kind of got right beyond all the defenses. And of course you have to be really respectful and really careful in that space. But it allows a sense of connection that people may not have been able to experience in other ways. And you can that connection can help facilitate some kind of movement. And so my best days are those days when I just feel guided really quietly to do something that brings us into a state of connection. And look, sometimes it's not even that obvious. I remember telling a guy something that he really didn't want to hear, and actually confronting him, but I did it from a state of really loving him. And he didn't come back for 3 years, and I thought, he just thinks I'm a jerk. He doesn't want to see me again. He doesn't like me. And actually 2 or 3 years later, he came back and had changed his whole life from the one conversation. And so we just don't know what it is, but we just have to be willing to be present and to be at service and to be caring for that person. And then we can often be guided to places that are, you know, deeply satisfying for everyone.
That's a beautiful words, Penny, and to be present, to be caring, and to be of service. I think you know, if all of us could even take one thing away from this conversation, that's going to be allowing us to be in a completely different state, to perceive life in a completely different way, which really does allow you to connect a lot more with your intuition and yourself, and open up a whole new life that you can see. So thank you for those words. I've got another question here from Michelle. Michelle says, I've spent years thinking my chronic fatigue and digestive issues were normal. Now I know they're not, and I haven't quite yet figured out what to do to be my former energetic self with great digestion. Do you have any advice for me, Penny, either what I can do for myself or with a practitioner?
Yeah, look, it's great to have a practitioner who can really listen and hear you. So I think that you do need to use your intuition a bit when you see someone, you know, and just feel if they're the right person for you. But if they're really listening and really hearing you and don't have their own agenda, then they're probably going to be a goodie, especially if they're recommended by someone else. But essentially the things that you can do for yourself are to and eat a kind of non-inflammatory diet, you know, to back off inflammatory foods, to take chemicals out of your home, out of your personal care products, out of your food. And the non-inflammatory diet is really about eating really less sugar or no sugar. It's about eating, I mean, I don't mind so much the sugar in whole foods like fruits and stuff, but take all that other refined, rubbishy and pro-inflammatory sugar out of your life. And reducing carbohydrates is also really important. And interestingly enough, you know, lots of you have probably heard this, but fat and oil is really good for you, and it's particularly good for your brain and all your cell membranes, and it really helps for healing. And so we've been encouraging people, and again, individually, because some people do better with some things than others, but to increase the good fats in their diet. So fats from eggs and from coconut oil and cold pressed olive oil, and avocados and nuts and seeds, and go for foods that are just look like someone's picked them from somewhere, you know, that look like real foods, and take all the other foods totally out of your diet. And there is a case initially when people are have a really kind of inflamed and irritated digestive system, to get rid of some of the things that are harder to digest, and that would be, you know, wheat-based, gluten-based products, and for some people dairy as well. And that may be a temporary thing, but it can often help. And so those are the really simple things you can do. And the other thing is that your whole gut is informed by your autonomic nervous system, and your autonomic nervous system is, you know, part of it is the nervous system that activates with stress. So you've got to give yourself a break. You got to have rest times. You've got to do meditation or walking or prayer or whatever it is that brings you into a state where you're feeling nourished, so that the messages from your brain go from those stress messages, which make your gut kind of go tight and ineffective, into a gut that can be much more relaxed and can function normally. So those would be a few of the things that would probably really help, and would help your energy levels as well.
Thanks for the great advice there, Penny. And Michelle, I'm sure that's helped answer some of your questions. I'd also, Michelle, as you're aware, Penny, we do a lot of work in looking at the personalisation of things, and I'd really encourage you to check out ph360.me, Michelle. Can give you a lot of a great tangible way to start, and can really help you understand a lot more of the foods and things like that are right for you at this point in time. And a lot of the concepts that Penny speaks about are very, very important to harness for yourself. So thanks for the question, and thank you very much, Penny. Penny, we've got another question here that we've got quite a lot of questions that are coming through. Let me just see how Cassandra says, I agree, I wish Penny was in Denver. Pam says it would be great to see a doctor who actually listened. There's amazing doctors out there, and it is a matter of just taking the time to find a really great doctor for you. It's very similar to the way Penny practices, that does listen to you, that is there for you, that does understand a lot of these new insights about how the human being is a very dynamic, interactive system. So there's plenty of hope. And I know that Penny and many great organisations, Ultimate Human Foundation, are working very hard to be able to change the conversation across the world, but it is going to take a little bit of time. So Anthony asks, Penny, does the 1.5 metre electromagnetic force extend to virtual communication? Are we affecting each other's hearts and brains right now during this call? That's a great question, Anthony. Penny, I'd love to hear your thoughts on that.
Oh, look, I think just looking at Matt's smile makes biochemical changes in my body. Yeah, look, I think that just hearing words of encouragement, of warmth, the things that truly resonate and feel authentic, words of hope, automatically make a difference inside of us, you know. And so we know that when you're when people get sick, they often get cold sores and stuff like that, or if they're tired, they get cold sores, or they're stressed, they get cold sores. That's because as soon as you produce noradrenaline, which is the chemical of stress from your brain, you get this shower of free radicals through your body, and it just eats up all your antioxidants. And so, like, those things happen so quickly that we just don't even realize how much what we see and hear and feel affect the way we're functioning biochemically inside. And so if I was watching, say, some kind of horror movie at the moment, and my stomach went into knots and my adrenal glands are going, oh, and they start producing a whole lot of cortisol and even worse, adrenaline, then my whole body is just going to get depleted really quickly. And it's going to take me, even if I stop watching the movie, it might take me a good 15, 20 minutes, few hours to get that all out of my system. But if I'm watching something or being with someone who's loving and authentic and is sharing, heartfelt messages, that the exact opposite thing is happening inside of us, and that then has a biochemical effect. So I think whether it's an electromagnetic effect or a biochemical effect, and I'm sure, like, Matt here could answer that question in a whole nother way, and add some more elements to it. But I think we affect each other in any kind of communication, even in email. You know, how we speak to each other. That's why we've got to be so careful about when we press that send button, that we've really, you know, thought about and felt in our heart about what we're saying to someone else, because we affect each other all the time.
That's great words. Thank you, Penny. And I won't add too much to that for this conversation, but just to, I guess, for everyone to be really aware that we're finding out and understanding a lot more about how our intentions can actually, you know, affect a lot of other people, and our thoughts can affect ourselves and other people. We heard from Roland at HeartMath how the way that we are in ourselves, the energy that comes from our heart, there's actually more information that comes from our heart to our brain than the other way around. And our heart that extends to the field, we now know that our hearts are connected to this, you know, the collective field in the environment. And we now know that the environment connects to other people's hearts. So, you know, effectively, all of us sitting here, whether we're actually having a direct conversation or not, what we do, what we experience is all going towards the collective field and the collective energy, if you like. And now this is being proven with science. So it's some really exciting times to be able to have some quantifiable information that does show exactly what you say there, Anthony, that we're actually all connected and we can all influence each other without us even being aware of it. And I really see this in the future, that we're going to be having information and science to be able to prove, you know, how we actually as individuals affect the collective and how that influences each person itself. And when we're at that point in time where it's actually, you know, some hard data that shows that, I think we're going to be having some different conversations about, you know, what we think and how we act and how that does influence everybody else. But we also had a great conversation, you know, recently. I'm not sure if people might be aware of the Noetic Sciences Institute in California, Penny, but we've got Dean Radin, who's actually on this afternoon, talking about paranormal healing and paranormal sciences, which is a very interesting conversation. And they're actually, you know, leading the way and looking at the science behind how how telepathy and how distance healing and these sorts of things work. We've been involved in some interesting research looking at healers and measuring their brain activity as to how that will actually influence someone else's brain activity from across the other side of the world. How doing some, you know, conversations about beliefs and mind reprogramming, like we had earlier this week with Morty Lefko, how that can actually influence someone's brain activity. So there's a lot of science and research that's exploring, you know, these phenomena about how we can actually influence somebody else's state of health and their hearts and their brains from a distance or from afar. And these are concepts that they sound very airy-fairy in science and medicine. You know, I'm very much in the Western medicine and Western science you know, fields as you are, Penny. Yet it's something that you know, we'd be negligent if we ignored the fact that we see it and we can, you know, understand that this stuff is actually real. Just because we can't explain it yet with science and we don't understand why, it doesn't mean it's not real. And so, you know, it's amazing to see a lot of people now looking to study it and to get some data behind all these crazy things that exist that we're just finding out now. So without going too far down the deep end, Anthony, I think it's a great question, and it's something we're going to be finding out a lot more about. And I think it's really important for us to be having a lot of the research that's happening around it so that we can actually understand from a tangible way how this works and how we can actually harness that for health and happiness. So moving on for more questions here, we've got Pam says, it's excellent, Michelle. I've struggled with my energy for years, and after using PH360 since April, I feel like a new person. Forgot what it feels like to have the energy to do everything I want to do and last all day. Amazing insights, Penny. I'll be replaying this call and getting my heart and my brain back on track from Penny and Matt's energy and smiles. Pam says, I do an online heart circle every week with people across the world, and we can totally feel each other's energy. It's amazing. Thank you for sharing that, Pam. There's, what else, other questions have we got here? Penny, your insights are opening my eyes and my heart. This is a great question. What can I do after you're gone from the screen to bring my mind more in harmony with my heart, soul, and spirit? And this is a great question. Thank you so much to say, you know, again, bring this back to everybody who's listening either live today or on the replay. Penny, what can we do right now? You know, when you do leave the screen here, what can we do right now? What can all of us listening in right now, no matter where we're at with our state of health, what can we do to actually bring our mind more in harmony with our heart and our soul and our spirit?
Look, I think when, you know, again, different for everyone, but, you know, when I sit with patients, I often ask them, you know, what are the things that you can remember in your life that have been really nourishing for you? You know, what are the things that you've done? And everyone has some things, you know, they might have to do with being connected with other people. They might have something to do with their childhood. It might be, you know, the walking in the woods. It might be sitting and meditating. It's all those things that we've already talked about. And so I think it's really important to to value the things that nourish you and value taking a break as much as you value anything else you do in your life, because your body and your mind and your soul are totally dependent upon you doing those things to stay connected and stay well. So when I turned 50, I decided to, I just knew I had to have 3 months off work. I didn't really know why, but I knew I had to do that. And I ended up doing some pretty cool things in those 3 months, including a pilgrimage in Israel and an amazing festival I went to where Bruce Lipton was, and doing some traveling and being with people I loved, and realizing some things that were unhealed in my life that I hadn't realized before. And a few months after that, and you know, everyone was like, yeah, she's back at work, thank God, you know, keep the balance sheets flowing. And then a few months later, I realized that I wasn't there yet. So I took off for 6 weeks and I walked the Camino de Santiago in Spain, which is one of the first pilgrimage trails, because I knew that somehow internally I needed that space. And my husband wanted to come, and I said I didn't want him to come, not because I don't, you know, love him and adore him, but because I needed to not be a mother, not be a wife, and not be a doctor, and find that real quiet space that allowed me to find the healing that I was looking for inside. And so I think it really is about, you know, don't put limitations on what you can do for yourself. You know, I'm too busy to do this. I don't have time to go to my yoga class, to have a break, to have a holiday, to do this. Because actually my experience is that when you make the right decision for you, however radical it might feel for others, everything will fall into place. And so for that 3 months when I took off and then we didn't have enough doctors and one of our young doctors had left, you know, someone called 1 week before I left and said, I want to come and work full time in your practice. And so, you know, really that the field does somehow conspire to help you to do the things that you need to do for yourself if you're really making the right decision for yourself. So I think it's, you know, I can't overemphasize the looking after yourself. And of course, you know, dechemicalizing your life makes your mind much clearer, makes it easier to connect. Eating good food does, you know, walking, exercising, loving, being loved, all of that kind of stuff is really important. But trust your kind of inner knowing about what you need to do for yourself. And you can never go wrong. And of course, you know, you'll make mistakes, but just watch the mistakes and re-feel what it is that you need to be doing.
Thank you so much, Penny, for sharing that insight with us. And Penny, as you're very aware, I'm very interested in the future. I often talk about future health and medicine and things in that capacity. From where we sit at this point in time, what hope do we have as humanity? You know, we have epidemics of chronic pain and disease that exist, you know, everywhere all over the globe. We have over 3 billion people as we speak suffering from chronic pain and disease right now. The information and the insights that you're bringing here are phenomenal and you know, offer, you know, a lot of hope for us to either, you know, prevent or reverse chronic disease states and all these other things that we're experiencing right now in the world. Where do you see the future going with this? Where do you see integrative medicine coming in and being exposed to the masses? You know, how is this going to change health and our trajectory, I guess, of humanity moving forward over the next coming years or even decades?
Look, I think that human beings somehow need to be up against the wall to make change. You know, there are the early kind of changes and the people that kind of lead the way, and initially they're thought to be kind of maybe a little bit mad or something, or they're getting it all wrong, because we live in this kind of state of collective delusion, which is like, if we all believe this works, it must work and it must be the only way. And so there are people who lead that, and then there's a point at which there's a small nidus that gets going and that grows, and you never need a majority of people to make change. There's always a small minority who are really committed, who really understand, that somehow you get that kind of the ripple effect, and it really starts to spread. And I think we talk a lot in Australia about there being this kind of wave of integrative medicine, that it's certainly been driven by the public, it's been driven by the patients, it's been driven for a need for something different, and it's really, strangely enough, just going back to really simple things. This is not complex, this is really simple, but we've got so bloody clever that we've forgotten that the simple things are what really make the difference. And so I think that there is a wave, or there is this kind of nidus that's really growing now, and there are lots of really interesting people driving it. I've been meeting great people in Boston here that are doing really interesting things to kind of remodel, reconfigure how we're looking at health, and what would lead to people back to well-being from being in a state of chronic illness. And so there are things that I can tell you that are happening everywhere in every country around the world. And I think that we just need to keep supporting each other, keep doing this this path with like-minded, big-hearted people, and we're going to find our way. I mean, I'm an eternal optimist. I always know, have an idea about how bad things are, and as we all know, it's pretty bad at the moment in almost every area that you look at. But I really believe that we can turn this around, and that we can bring humanity and authenticity and love back into what we do. And I guess deeply, at a deep level, I really don't doubt that this is possible, and that it's going to be, in so many ways, kind of our salvation as human beings, to find this sense of connection internally and externally as well, and to be informed by and to inform the field. And I think we can do that.
Mm-hmm. That's great. There's hope for us yet, Penny, and I know that we certainly share that same feeling. And many on the call today, and I'm hoping that that's the message that will resonate with a lot of people from the amazing wealth of knowledge that we have from Penny's call and from all the other great calls on this summit series, that there is hope for us yet. There's a lot of information, there's a lot of wisdom, there's a lot of knowledge out there, and new understandings about who we are. As Penny says, there's a few crazy people that need to lead a bit of a change in the conversation, and as the conversation changes, those people become less and less crazy in most people's perceptions. But I really value the work that you're doing so much, Penny. Is there a link that people can find out more about you, Penny, or more about the work that you're up to that you could share with us?
Sure, but I just want to say one thing first, and that is that I want to say the same thing about you, Matt, that the work that you're doing is just really amazing, and the PH360 is an incredible tool that everyone should have a look at. And the facilitation of the conversations that you're having are really important, and the linking to everyone is really vital. So thank you so much for everything that you're doing.
Oh, thank you. Very kind.
You'll get a little bit of an example of what an integrated practice might look at by looking at invitationtohealth.com.au, and I'm really pleased that I can say that now, because we've just redone our website, and prior to that it was pretty awful. There's AIMA, or the Australasian Integrative Medicine Association. If you Google that, you can find it. Unfortunately, our website's about to be redone. It's pretty much a little bit like the state that my practice website was in a little while ago. So hold the space maybe there, because it's not so good at the moment. But there are a lot of integrative medicine organizations in the US. So Institute of Functional Medicine, AIHM, the Consortium of Academic Health Centres. I mean, there are organisations all over the place. So if you look for integrative medicine, if you Google that, you'll find a whole lot of places doing really interesting work, and lots of research as well. So those people who say things like there is no research to support what you're doing is just really, unfortunately, a bit of a state of ignorance, because there's a lot out there.
Yeah, I think that's a fairly old conversation these days. And please go and check out invitationtohealth.com.au. Penny, we love the work that you're doing. I love the work that you're doing leading the whole of Australasia in these conversations, and really encourage everybody who's on this call or listening to replays, please share this with your family and friends. This is all free information for you to become aware of what's out there. Please support Penny on her journeys. The Australasian Integrative Medicine Association are doing some phenomenal things, all backed by Penny and your team. So thank you so much for being here today, Penny. I know you're extremely busy, and really, really grateful for your time and expertise and wisdom and knowledge that you've shared with everybody on the call. For those listening in, thank you so much for being here and investing the time into your own health to learn about these concepts and how you can apply that to your specific situation to move towards a state of health and happiness, or prevent anything from occurring in the future for you. So please go ahead and like the Facebook page so you can get all the updates, all the goodies, all the speaker schedules and everything that's there. And please like the YouTube channel, which has it gives you access to all the video replays for free for the entire summit series. So once again, Penny, thank you so much for being here and sharing everything that you have. And I really just appreciate your perspective so much. Thank you to all for being here, and we shall talk to you very soon.
Lovely. Thank you, Matt.